Hello, dear students. So we will continue with the different management options for fibroids. And as always, we said some patients do not need any treatment. So the first option, always think about whether this patient, does she need treatment or not? Because for some women, no treatment may also be an option. So talking about medical management, so if a patient presents with heavy menstrual bleeding, we can give her all the medical options which are given for heavy menstrual bleeding patients. But keeping in mind that women with fibroids, in them the medical management may be less effective. If surgery is indicated, myomectomy, right? So myomectomy is one of the options, which is a fertility preserving surgery. But we said that because there is 1 to 3% risk in general, for some women it may be higher, of losing the uterus because of intraoperative heavy bleeding. So to reduce the risk of hysterectomy while we intend to do myomectomy, we can give patients two medications. Okay, one of them. First is GnRH analogs or GnRH agonists. Okay, so what basically they do is they cause pituitary shutdown. So why it is important? Because pituitary releases FSH and LH, and we know that FSH it's the follicle stimulating hormone, right? And LH, it causes ovulation. So once FSH and LH are down, then of course there is no ovulation, follicles are not stimulated. As a result, automatically estrogen levels and progesterone levels, they go down, and women will have amenorrhea. But it is important to know that in the initial stages, once GnRH agonists are given, so initially there is this flare effect. Flare effect means initially it stimulates the pituitary to release more FSH and LH, but then it desensitizes the pituitary by it continuously causes occupation of GnRH receptors. Okay, so do not memorize exactly the mechanism of action. Just remember that initially there is a flare effect, and then followed by it just causes a pituitary shutdown, which results in amenorrhea. And what it is called? It's called pseudomenopause. So patients will have hot flushes. She may experience vaginal dryness, all the signs and symptoms of menopause. Okay. These are given, GnRH agonists come in market in two forms. One is nasal preparations, the second one is intramuscular injection. So in gynae, we use intramuscular injections. So these intramuscular injections, they can be given 1 monthly or 3 monthly. So they are depots, right? So like big doses. They are quite expensive. Okay. And even 6 monthly preparations are available. So for 6 monthly, I know at some hospitals it costs almost 2,800 dirhams, the 6 monthly one. Okay, and pre-operatively, what do? They reduce the size of the fibroids by 50%. Okay, but it's good for the patient because the size of the fibroid is reduced by 50%, but the procedure becomes technically slightly more difficult because after GnRH agonists are given, the surgical planes are lost. What does that mean? See, fibroids normally they have a capsule. So once these GnR, and it's easy to identify fibroids and remove fibroids once this capsule is reached, right? So and identified. So, but when the surgical planes are lost, it is difficult to identify this fibroid capsule. Like all, it's kind of a mixing of all surgical planes. Okay. So technically it becomes difficult, but the good thing is it will reduce the risk of having hysterectomy. Okay, and one more problem, fibroids can regrow after stopping this treatment. Okay, so that's why like we use these GnRH agonists only before doing myomectomy and not without doing myomectomy. Okay. I talked about pseudomenopause, and yeah, so if GnRH agonists, they are indicated in for many conditions in gynecology. Anyways, if we have to use them, usually we prefer to use them for maximum of 6 months. But if we have to continue using them, the maximum period is for 2 years. Okay, but after a period of 6 months, what we have to do? We have to do hormone replacement therapy because it can lead to osteoporosis. Remember, it causes low estrogen levels. Okay. If a patient says, I do not want an injection, Then what is the other option? That's a medicine which is selective progesterone receptor modulator. That's the mechanism of action. The name of the medicine is Ullipristal acetate. Okay, it has many uses in gynecology. On a short-term basis, it's also used as an emergency contraception. Okay, so and we have another lecture on contraceptives, but if we have to continue it, like if we are using it for fibroids pre-operatively for myomectomy patients, then it is given as a tablet. Well, it's always a tablet form. The patient needs to take it every day. Okay, there have been many concerns related to this use of this medicine and liver failure. So in many countries in the Europe, it was even banned. Okay, in the UAE, it's a controlled medication. Okay, so it means it should be prescribed by specific people, like not a GP, right? So and it's done by something called open jet prescription.